Coping with cancer, how to handle initial shock. How do you cope with the initial shock of a cancer diagnosis? This moment can feel overwhelming, and it is completely normal to experience a whirlwind of emotions. When you first hear the words, "you have cancer," it often feels surreal. Many people report feeling numb or stunned, as if their emotions have temporarily frozen. This reaction is a natural response to such intense news. You might find it hard to believe what you are hearing or to accept the reality of your situation. This numbness can act as a protective barrier, giving you time to process the information. It is common to need details repeated several times because your mind may struggle to absorb everything at once. Another common reaction is denial. You may find yourself avoiding thoughts about the diagnosis. This can be a subconscious way to shield yourself from emotional pain. While denial can provide temporary relief, it is important to seek support if it becomes overwhelming. Talking to healthcare professionals or counselors can help you navigate these feelings. Processing emotions after the initial shock can be a mixed bag. You may experience fear, anger, sadness, guilt, or anxiety. It is normal to question why this has happened to you and to reflect it on your past choices. These emotional ripples can linger for days or even weeks as you start to understand what living with cancer means for you and your loved ones. So, how can you effectively handle this initial shock? First, allow yourself to feel and express your emotions. Whether through crying, talking, or writing, it is important to let those feelings out. Seeking support from trusted family members, friends, or support groups can provide comfort and reassurance during this tough time. Take time to rest and do not rush into decisions. It is okay to take a step back and gather your thoughts. When you are ready, ask your healthcare providers to explain your diagnosis and treatment options clearly. If you need clarification, do not hesitate to ask them to repeat information. If feelings of panic, denial, or distress become too much to handle, consider reaching out to a counselor or psychologist. They can provide strategies to help you cope with these emotions. Remember, coping with the initial shock is a personal journey. It is okay to feel vulnerable and uncertain. As time goes on, and as you gather more information and support, you can begin to shift from shock to adjustment. This process is unique for everyone, and it is important to be gentle with yourself as you navigate this new chapter in your life.